everyone, and welcome to episode number 3 of the Pelvic Bowl. I'm Dr. Krystal Lynn Couture from the Pelvic Acu, and we are here to talk about acupuncturists bringing pelvic care to their practices as a specialty. Today, I am joined by Dr. Andrea Orvieto. Dr. Andrea is a doctor of acupuncture and Chinese medicine. She is the founder of SoFla Acupuncture and Wellness in Hallandale Beach, Florida. She holds a fellowship with the Acupuncture Board of Oriental Reproductive Medicine, specializing in integrative fertility care, and she has an advanced certification in pelvic floor therapy. Her clinical focus includes fertility, women's health, and pelvic floor dysfunction, blending the wisdom of Eastern medicine with evidence-based approaches. Known for her compassionate care and deep clinical insight, Dr. Andrea creates personalized treatment plans that support healing on every level. Welcome, Andrea.
Thank you, Krystal. I love seeing you. I love being here.
Oh, wonderful. Well, it's glad to connect again. And of course, Andrea hosted one of our very first pelvic care practicals at her clinic in Florida. So we have a really nice, strong connection, and we've been Acu besties for a while now. But I'm really excited to interview you about your journey into pelvic care and what that's been like for you, and hear about some client stories, etc. You ready to get started?
Sure. Let's get started.
Okay, awesome. So why don't you tell us about your journey as a healer leading up to this point, your pelvic care advanced certificate?
Sure. So I've been in practice now, we're in 2025, right? So I got my license in 2017, and I've had my own practice here in Hallandale, since 2019. And initially, when I first started practicing, I wanted to treat everything because as an acupuncturist, you come out of school and like, I want to treat everybody and everything. And I still do, and I still love that. Um, but I realized pretty quickly that it's important to find a specialty of something that you're passionate about and can really talk to the audience, talk to your audience. And funny enough is when I first started acupuncture, somebody that practices here in South Florida first told me that I can never make a career as an acupuncturist if I want to make money. And number two, they told me to stay away from fertility because it's too much pressure. And this is a female. Okay.
Whoa.
And so I don't know that I ever shared that with you.
No, you didn't. This is shocking to me.
No.
Like, I have chills. Like, what?
Yeah. So as a new practitioner, I was like, okay, well, I won't be treating women's health or fertility because it's too much pressure. And who wants that? And this was very, very early on in my career. And then one of my good friends, or I met somebody, there was two stories that like that kind of simultaneously happened. A good friend of mine was having difficulty conceiving, and somebody else that I met had a very good friend that was just had a miscarriage. And they asked me, like, I randomly met this other person, and they asked me if I treat infertility, and I was like, "Mhm." I was like, of course I do. Because at that point, how can I say, I want to help people, right? As an acupuncturist, we still want to help. And my good friend, I was like, I want to help support you. I know that I can help support stress and anxiety and all of that. And that was just the tip of the iceberg for me of getting into women's health. Um, and so that's kind of initially in the beginning, I was shying away from it. I did not want to treat it because somebody had told me. And then two things happened at once that kind of got like that the snowball effect that one person started with me, then a next, and then I was like, all right, well, I need to really learn about this. And then I started taking more courses of fertility courses to see if it's something that interests me. Obviously, I'm a woman, but it doesn't necessarily mean I want to treat that. And it did. And at that point, I knew about the ABORM, but I had just started practicing. And then when I was eligible to sit for ABORM, COVID happened. and I was pregnant with my first child. So that went on the back burner, but I still continued doing my continuing ed in it. And I was like, this is fascinating. I started helping so many couples, women, men, all of that. And that's just kind of a snowball effect. And then after I was pregnant, especially after my second pregnancy, I was experiencing a lot of incontinence, which I'm very open about and I've spoken to you about. And I, at that point, learned about pelvic floor physical therapy. And I explored that with a physical therapist who was wonderful and lovely. And then when I started to see your post, I was like, well, I need to get in on this because it just, with my focus on fertility, everybody that focuses on fertility should know about pelvic floor care because it goes hand in hand. It's not two separate things. They blend together beautifully. And it kind of completed, I mean, I'm sure there's more stuff that I want to do, but it kind of completed that whole care package of women's health, fertility, even male health as well. So that's kind of where it sparked my interest. And then I was like, hey, you interested in coming to South Florida? And there we go.
I love that so much, Andrea. It's so interesting how what someone says, right? The vibration of what someone says, whether it's negative or positive, either vibrates in or vibrates out. And in this case, even though it was negative, it was something that vibrated in for you. It was almost like the don't come near me brought it closer. And you were like, I have to eat this up. Like, this is the medicine that I'm
Totally.
going to share with the world.
Yeah. And I live in Florida, and let's be real, like in the United States, women's healthcare is not number one. And in Florida, we definitely we're lacking there even more so. And so I think that I was like, you know what? I want to bridge this gap of um this dead zone of, okay, we have Western doctors, which I love. I work a lot with Western doctors and these patients, and there's this lack of communication that happens, and we get frustration, and where can I bridge that gap in the middle? And I feel like I've done a really great job with my patients and building relationships with incredible Western practitioners, all different types, and myself and my patients, and it makes for their journey to be much more fluid, for sure.
Yeah.
You're absolutely right with the vibration. I'm like, somebody said no. I was like, okay, well, no, but yes.
Exactly. Exactly. Andrea, I think that's one of your greatest skill sets. Like, having gotten to know you, is you have this immense knowledge base, and you also have the best connections. And that sort of service that you provide to your clients so that they have a full experience of support through you and through
Thank you.
their providers is just, it's so beautiful to witness. I just love that so much about you. So what would
Thank
you,
you.
yeah, for sure. What would you say is like, what was the turning point? What was like the snap moment of deciding to bring pelvic care in? Because even though it makes sense with fertility, especially now, because you've been through both programs in full, right? Um, there's still got to be something. So I want to know what was the trigger to like say, you know what, I have to have pelvic care in my practice.
Um, Selfishly, I wanted to learn for myself as well, where I had experience with some really great pelvic floor physical therapists, really great. But once I stopped getting care from them, um, my symptoms came back. And yes, part of it is on me as the patient, but I felt that there had to be more of how I can be helped, that it's not something that I have to continuously get care for forever with some type of a practitioner. And that's part of it. You know, where else can we fit this in? And we know acupuncture does a great job with that. Do we have lifelong patients? Yes, we have lifelong patients. Number one, I think they love coming and they love being part, even if they're coming once a month or once every 2 months. Some people have chronic uh, terminal illness type of things that help them alleviate these symptoms. But I think with pelvic floor care, it's not something that has to be forever if we educate appropriately and we treat it from a muscular point and an emotional point as well. And I said, well, I need to learn this and bring this in. And that's number one for like the postpartum. But there's also something there for my fertility patients where I was like, what more can I learn to yield even better results with these patients that are continuously getting diagnosis of unexplained infertility, or we're not sure if we have endometriosis, and the only way to know is to like actually go in. And some people don't want to do that. So I feel that pelvic floor care, it was like a no-brainer for me. Like that, I was like, this is a must. It goes hand in hand. And I think that everybody in the acupuncture world that specializes in fertility needs to bring some type of pelvic floor care as well.
Yeah, for sure.
That was just like, makes sense to me.
Yeah, it really does. And if you think about it, right, like what supports, you know, the baby, right? What supports the baby if we make a baby, right? And there has to be support in place. There has to be a foundation for the house to be built, right? If there's not, then the first windstorm's going to take it down. So the pelvic floor is the foundation. I think is so important for fertility. And I love that you really made that connection. And I love that you also had, your personal sort of experience that called you in. I would say that like 75% of people that are doing my program are like, yeah, I really want to do this for my clients. And I also really want to do this for myself. And
Yeah.
that doesn't strike me as selfish at all. That strikes me as providers taking care of themselves. And if we're taking care of ourselves, then we're going to do such a better job taking care of our families, taking care of our clients, and, being aligned with our Tao. So I love that. And I like that was your real turning point, was like, hey, I need some more help. I also, can I share a story about you?
Of course.
Not super personal.
Yeah.
But
I'm an open book, but yes.
I love that after we worked in class at the practical, on the first day, you were like, yeah, I'm going to the gym, tonight, which is hilarious because it's a full day of class. It's like 8 hours. It's at your clinic. Like so much is going on. You've got kids. I don't know how you managed to get to the gym that night or the next morning or whatever it was, but you did. And you were like, dude, I did things that like I never could do without leaking before. And that was so amazing. Like you just came in so matter of fact the next morning in class and we're like, yep, I did things I never did before. And I was like, okay, this is medicine. Leaking. And that was just the beginning of treatment of class. And I don't think at that point we'd even treated the pelvic floor itself yet. It was like concomitant structures.
I think it was just like the back and the abdominal muscles, I believe.
Yeah. Yeah. So that was super cool. Thanks for letting me share that.
Yeah. Yeah. Yes.
So what would you say?
I know I'm also like I'm also like the worst patient because you're like, well, like we want to give it at least 24 hours to like settle in, which I tell my patients like, no, you can go for a walk, but like nothing strenuous. I was like, sure, no strain. I'm going to go jump rope now. Like, I just wanted to test it.
Right? I gotta test this out right now.
Yeah.
So life is happening, which is really, really cool. And I love to see those effects, happen so quickly and over time. I also think, for a client, that may not be a typical result, right? A classroom setting with a lot of practitioners working together brings an energy of healing that is really, really potent. It's wild. And so things like this happen a little bit faster than they might happen in client sessions. So I wouldn't say that that's necessarily a typical result for a one-on-one session for a client, especially if they've been struggling with, leakage for 20 years, or they've been struggling with, fertility for a really long time. But these kind of things do happen, and they're really special when they do.
It is. And we in the class we're treating a lot that we wouldn't treat in one day of treatment with a patient. They're strong. It's strong needling, not necessarily painful, but powerful. And we're hitting all of the muscles. So we learn what it feels like. We get it, we receive it on ourselves, we do it on somebody else. And so the treatment, we're not only getting treated by one other practitioner, but sometimes you're treating me, sometimes two different practitioners, which is a very interesting result, because everybody has their own style and their own energy that they bring into it.
Yeah.
So it was very cool.
It's
Yeah.
such a cool experience. It's magical. So what would you say out of all like the tools in the toolkit that we worked with at class and
Mm.
kind of on the emotional, spiritual level as well, what would you say is your greatest asset or tool in the toolbox for your clients since you've brought in the pelvic health specialty?
Mm. I wasn't ready for this one.
Mm.
Um, are you asking like actual treatment base for patients, or
Could be. Could be whatever, so people have,
I you
yeah,
know
go there.
so what it is we even before touching a patient for treatment, hearing them and giving them the possibility and that hope of, I hear you, and this isn't normal, it's common or not common, and there's something that we can do about it. And this isn't necessarily um a quick fix, but it's giving them the opportunity to improve their quality of life, whatever that looks like, because it all is dependent on what they're coming in for. And I think that the knowledge base from this course, that is not just musculoskeletal, which is a very important piece of it, but it's also an emotional piece. There's also the emotional piece that we work with that I'm not necessarily speaking about with the patient in front of them, because we get there when we get there, but giving them the opportunity of saying, oh, this isn't forever and it can change, is the biggest, is probably the biggest tool, best tool in my tool set. Because once they are open to it and once they hear that, getting them on the table and doing the stuff is just part of what we do as practitioners.
Yeah.
So I think the best tool is understanding, hey, I can help them because I have the tools to be able to help them. And I think that's the most important, because then I they have my they feel heard. They feel they can trust me. Hey, this practitioner knows what they're talking about. They're not dismissing me saying, well, this is now something that you have to live with forever, and it may or may not get better, or sex may be painful for the rest of your life. So maybe you're not going to have um, intercourse. You have to be creative or have a glass of wine or whatever the situation may be. That's life changing for the patient right then and there.
Yeah, for sure. I think you like wrapped together so many amazing things there, Andrea. I think, the concept of trauma informed care, I think is something that you're bringing in. I think building rapport, I think active listening, I think making sure that we're not gaslighting our clients or normalizing their symptoms and just showing up in presence and then using what we have to support that. And we have so many things to support clients where they are in pelvic health as acupuncturists. Before you even take a specialty class, you have a lot of things in your tool belt that can really help. But it's that presence, as you just mentioned, that is so, so important. And it's important for every client that walks in the door. But for pelvic health, it's in fertility, it's especially important because these clients are so, so sensitive. They're so underserved. And
They're
there are so
dismissed
many,
a lot.
and they're dismissed, and there are so many of them. So many. So yeah, you really just hit it. And I love that that is something that has translated, into your practice and is something that you felt compelling within our course too. That's like the basis of, why we're doing what we're doing. So I really love that. Um,
Yeah.
yeah, go ahead.
Yeah. I was going to say is like, I have a patient that's a regular acupuncture patient. I know this is not necessarily on topic, but it is on topic. She's a regular acupuncture patient of mine. And this patient is in her early 40s, and she's been experiencing in the last year urinary tract infections and bladder related symptoms.
Mhm.
And she keeps being told that there's nothing wrong. And maybe there's nothing in the sense that there's no bacterial infection, but what she's feeling is real.
Yeah.
And this woman has she has two children. She had a C-section, and in between that, she's had a loss. And there may be other stuff there that I have not unraveled yet, that she's not yet comfortable sharing with me. And I never try to pull that information unless that information is ready to come out. You know what I mean.
Yeah.
And she continuously asks me about my pelvic floor care because I explained to her, I said, I hear, I believe your symptoms. You are feeling this. And I believe that part of these symptoms is, you have a cesarean scar that was not addressed appropriately afterward, or you weren't given the right tools of understanding how to handle it, and some other trauma stuff. And, she keeps asking me questions. And one of the questions she keeps asking me is, well, if I do the pelvic floor care, do you have to go into the pelvic floor muscles? Meaning our hammock.
Yes.
And I said, not unless you're comfortable with it. And I left it with that. I said, there is so much work that we can do with your scarring, with the abdominal muscles, with the glute muscles, with your back muscles. But there's something there, right? Where I feel that in another setting, this patient would have been spoken to differently of like, well, the only way that you can get results is if we go into there, in
Yes.
that sense of we have to do that because, and clearly there's a fear or there is something that she's not understanding, or there's true trauma or all of the above, where I am able to read this patient and said, no, unless you're comfortable. We can do so much for you without doing that.
Yeah.
And I don't even say, well, if we go into those muscles, you could get even better results. I leave it at that. I don't say anything.
Yeah.
And so I guess what um, I'm saying is part of the magic of this practice of the pelvic floor, of the course that you offer, Krystal, is really teaching us that we trauma informed. These patients, a lot of them have had trauma one way or the other, in
Yes.
whether or not it's trauma toward to as defined by us or not, it's their trauma. And never push it on them. And when the time is right, whether it may or may not be, the time will be right. And I think that's a huge tool to be able to understand, and taking our ego and expertise of like, well, yeah, obviously, if we go into the pelvic floor muscles, we're going to get these results. No,
No.
we could get great results without.
Yeah, for sure. It's knowing when it's okay to put the brakes on and when it's an absolute necessity to put the brakes on. So thanks for sharing that. Um, that's a great segue into my next question, actually, which is, do you have a client success story that you would like to share?
Sure, I have a few. So this one I couldn't wait to share with you because um it's newer, and I was going to text you because I always text you. I was like, you're not even going to believe what's happening. So I have a patient in her 60s, and I treated her a few years ago for some medical stuff. And a few years ago, she was dealing with stress induced incontinence. And that's not what she wanted to be treated for at that moment. We were dealing with some other health issues. And In May, I sat next to her at my nail salon getting her nails done. I hadn't seen her in years. And we started talking. And actually, I think the last time I saw her, it was like maybe the end of COVID. I don't know if we were still wearing masks or something, whatever it was. I hadn't seen her in a couple of years. And I sat down and we're like, she says, "You've been on my list to call." And I said, "Well, look at that. I'm here." And we started talking about how she's doing. And she said, "But I'm still dealing with this stress-induced incontinence." And I said, well, guess what? I took an advanced course for pelvic floor care, and I think that you would be the perfect patient for it. And she said, "Oh, really?" Like she's a wonderful human. And I said, "Yes." She says, "I'm going away tomorrow, and I'm going to call you when I get back." So fast forward, and she went away and she called me as soon as she came back. And literally, I've been treating her now. I think we've had 5 or 6 sessions,
Mhm.
5 or 6, and I have not even gone into the pelvic floor. I've only done abdominal um needling and once or twice on the glutes in the back. And she came in yesterday and she said, "Andrea, there's a Aventura Circle here where it's a 3 mile it's a golf course and you can walk 3 miles." She says, this morning I went walking, and usually after mile 2, I will start to leak. She says, "I didn't even leak, not one drop. And I couldn't wait to
Wow.
come in and tell you." And this is life. This may seem minimal to some people because leakage can be all sorts of leakage, but this patient would go, it travels a lot. And she said that half of her suitcase needs to be pads
Yep.
because she doesn't know what her leaking is going to be like. Is she going to be more stressed from walking, tired, traveling, airplane, all of that stuff? And it's really stressful for her because most of her suitcase is just pads. And I said, "Well, my goal for you is that you don't have to bring pads with you." And she her leaking is minimal, if any, at this point, and we're not even halfway through her treatment series.
Wow, that's amazing, Andrea. I love to hear
Yeah.
results like that. And I love that, she perhaps like this other client that you're working with as well. People come back, they circle back, right? And they do so at the time that is energetically serving and fits you as a practitioner too, which I think is really cool. Um, there's something like 65% of people that are experiencing stress urinary incontinence that like feel and report that their quality of life is impacted. So, like,
That's the thing.
yeah. So, while like we don't necessarily, if we're not dealing with that, we don't think about it personally, but like it's a real thing. And the quality of life factor is so big. So, it sounds like you're on such a journey to help your clients to improve their quality of life. Like, that's amazing.
Yeah, she's so cute. I really love treating her because I'll put needles in her abdomen, and she's like, I'll come back into the room. She's like, I have felt energy this entire time through my body and my abdomen. I feel it immediately. And so I treated her a few times in the abdomens, like, once a week. There was a time that I treated her twice a week because she was going out of town. I wasn't going to see her for that week.
Mhm.
And one of the times I had her face down because I was like, I think I need to go. There's like some points that I really wanted to do in the glutes, in and in the lower back and all of that. And when she was face down, she says, "Andrea, I don't feel that same tingling." I said, "Okay." I said, "I'm gonna let me leave them there." I think I really like the point selection that I did today. I think it's important for your long-term process.
Yeah.
And then I came back into the room. She's like, "It just took a few minutes and I felt the tingling again." And she really loves the energetic feeling of what the needles are supposed to be doing. It's so cute. I love it.
I've heard that actually, like that's something it sounds like it's a bit obscure even for acupuncturists. But that's actually something I've heard and experienced after, 20 years of doing this. And I think it's because, the backside of the body is more yang. So it's so used to like holding the support while the front side of the body has that more yin aspect. It's more emotional. It's a little bit softer, a little bit more open. And I think that's got to be what it is. That's the only conclusion that I can come to. But it's definitely a trend that I have seen, particularly with those clients that are like in love with the sensations of chi.
Yeah.
Yeah.
She's so cute. And it's she's lovely. So that's been a really wonderful experience. And then one of my other patients on a different note is in her 30s. She's has three children. Two of her children, the two older, are like 16 months apart. So she had pregnancies and delivery very close together. And then her youngest is 2.5. And there's a larger age gap, maybe 2 years. She has three kids, five and under. So they're young.
Yeah.
And after her third pregnancy, she never felt right. She didn't feel like she went back to herself ever. And she was recommended an IUD, and within like 9 months or less, she's like, I am going crazy. She had her IUD removed, and she's experiencing things such as she's unable to lose weight, which is a big thing for her. She feels like her abdominal muscles aren't working, even though she's going to Pilates or she's doing things. She says there's certain exercises that she doesn't feel she can do because they're not working. She has, when she needs to have a bowel movement, it's like, right now I have to go or it's coming out.
Mm-hmm.
And she has some urinary retention as well. And if her bladder is some full and she has sex intercourse, it's painful for her.
Mm-hmm. Okay.
And so there's a lot going on with her. There's a lot of atrophy in the abdominal muscles. There is, the tilt in her pelvis is off. There's height, there's a lot going on. And she has lower back pain that won't go away, which we know it can be coming from a pelvis dysfunction, twist, torque, whatever it may be. And I recommended 16 treatments for her once a week. And she said, well, I'm going to be going away for 6 weeks in the summer. I said, okay, so let's do as many as we can do before you leave, and we'll see you twice a week. And in my head, I was like, okay, 1 week I'm going to treat her up or on the side, or I'm going to do those things to really optimize. We still have a ways to go with her. I wouldn't say her results are as immediate as my other clients. But there are things that have improved. She is not feeling that she has urinary retention anymore.
Wow.
She is having more complete bowel movements more frequently. And she feels a sensation in her abdominal muscles and her during her workouts that she's never hasn't felt, where she explains it as tightness. I believe that it's actually her abdominal muscles starting to work
Engage.
again
Yeah.
and engage. Yes. And so she still have her lower back pain, not as much, but I think that's going to take some time to resolve. I recommended 16 treatments for her initially because she did have many things going on. She may need more,
Mm-hmm.
depending on how she is when she comes back from being away for 6 weeks.
Totally.
If what she's going to be doing there to improve. We spoke about, I gave her a cork ball. I gave her different things to be doing, breathing techniques and all of that. And we'll see when she comes back. But that's she was miserable,
I mean, I think
very unhappy.
yeah, I think the most important thing here, right? All the symptoms are not improved yet. And there's a journey. And whatever she experienced up until this point has led to this point, right? Um, and so it sounds like there's a lot of things going on. And to make improvements with retention in particular of both bowel and bladder is huge, because those are the types of things that can bog down the system so tremendously as time goes on. Like, I think to have a difference there, the other stuff is going to improve. You know, you can make a difference in muscle recruitment. You know, you
Same.
can make a difference in pain. You know, you can make a difference in pelvic floor function. It might take time, but we can make a difference in those things easily. But of course, the bladder and the bowel, having those functioning, even if it's just 50% better, which it sounds like it's even better than that, even if it's 50% better, that is, I would say, a tremendous success. And I hope your client, when she comes back from her travels, like, can really lean into what successes were there, and also to understand how much of a journey this process is, and how dedicating herself with 3 kids, right? And a C-section scar, to her journey and her process
No,
and her
she
own
had
self-care.
vaginal.
Oh, they were
She didn't
vaginal. Oh,
have a
sorry, I mixed
C-section.
them up. Sorry, I
They
mixed
were
them up.
vaginal.
They were
Yeah.
okay. But still, having 3 vaginal births, I mean, is a lot for the system, right? And to
And
then,
very close in time.
yeah. So to be starting to bounce back, to have better organ function, I would say is a huge measure. The one thing you can do, Andrea, and I don't know if you remembered this from class or not, but having these clients to do the pelvic floor disability index,
Yes,
to
I
make
have to,
to
that's what we're
kind of,
gonna.
yeah, to kind of do check-ins, so that if they're like a little bit like, oh, well, I still have my back pain, and it's like, okay, here's the pelvic floor disability index 1, here's the second one that's 10 weeks later, and you know what, we still have this pain, but look what we improved so far. I think those objective measures can really help clients to be like, not like buy in, like sales pitchy kind of thing, but
No,
like,
but like, oh, it's working.
exactly, it's working on this level. And as we start to unwind more and more, the back pain has a better chance to improve. So I think that would be something I'd urge you to do, if you haven't,
When
as
she
a
gets back.
secondary
Yeah.
measure. Yeah, for sure, for sure.
She's so happy. It's interesting because this specific patient, um, our our kids are about a month apart, my youngest and her youngest. And when she was like, I want to say a few months postpartum, uh, she came in with her husband because her husband was also a patient, is also a patient of mine. And she came in once and never again. And it was nothing with me. When she came back in this time, she says, that time of my life was the most stressful time of my life. Or maybe it was last year. It was like a year after her baby was born. I was all over the place and I was not in the mindset for another, like, to start
Anything
something.
else?
And she
Yeah,
says, I'm so, yes.
yeah,
At first I was like, is it something that I did? And then, as a practitioner, we always feel, and I was like, you know what? It's not me. There's something going on. And then when we spoke, she's just in a different place. She's like, I'm ready.
yeah,
And that's like what we were talking about, like these vibrations and the time and all that. There's always that perfect time that a patient is like, all right, I'm ready to make that commitment. I'm ready to start that journey, and I'm ready to put in the work, because it's not just us that's putting in the work. The majority of the work is on the patient, right? They have to show up and do whatever homework if we recommend certain things. And that's a big commitment for them to be able to say, okay, I'm ready to take care of myself.
yeah. I love that. I love that. So, Andrea, what would you say? We're starting to get toward the end of our time today. So, what would you say to other acupuncturists who are like thinking about adding pelvic care, not sure if they should add pelvic care, freaked out by pelvic care? What would you say to them?
I would say, if you are interested in it, or are like scratching your head of like, what is this? Take the class. If it's not for you, you don't have to do it, but it just puts another tool in your tool belt, and you get some really great continuing ed for it as well. With that being said, I don't think that you'll ever be disappointed in the class. I think that Krystal, not I think, I know Krystal has put her heart and her soul into developing this course, and it is one of top classes I've ever taken. And you can really make a huge difference in your patients' lives, especially for patients that have these kind of weird things that are going on that you're not really sure. A lot of it can be coming from pelvic floor dysfunction. So even if you're not sure of pelvic floor, you don't even know what pelvic floor care looks like, take the course. It's it's great. It's fun. It's so informative. You get a refresh on your it's there's a Western meets Eastern meets five element meets so many different factors that, as especially after COVID, like we haven't taken a lot of classes in person,
Yeah.
that it refreshes you on all of the musculoskeletal and all of these points that you're like, oh my gosh, I forgot about how amazing that point is. And so this is a course that's not just for women, that's not just for men. It doesn't even matter if you treat fertility or not in your class. This is something that you would be surprised of how many people that you can help in your practice just by taking this course and putting it into practice in your practice.
Right on. So, Andrea, you have done such an amazing job, I feel like, of talking to both the acupuncturist and the client throughout this podcast, which is really what we're looking for, right? It's really about educating acupuncturists, educating clients, sharing your wisdom, sharing your journey. I feel like this was so rich. There was so much gold here. And if anyone in South Florida is listening to this podcast, you would be so blessed to be under the care of
Thank you.
Andrea, because she is just an angel. She's full of knowledge, and her presence is just absolutely top notch. And I will tell you, this girl, if she does not know it, she's going to find a way to find out about it. And then she's going to find a way to bring that in so she can help you. So for those South Florida folk,
I'm always saying, Krystal, like, what can I do for this? Don't worry, I'll figure it out, guys.
she's
I was
she's
like,
in
what
my
does
DMs.
this mean, Krystal?
And I love being a resource. That's just who I am. We share this kind of like, I think we're truth tellers, to the extent of it's a strength of ours, and also could be the greatest weakness. I don't know. But I love that about you. I love that about me. And here we are. So for those lucky people in South Florida, tell us, Andrea, where your practice is and how they can get in touch with you, because I want them to be able to do so.
Yes, well, I am in like the Aventura, Hallandale area. My practice is called SoFla Acupuncture and Wellness. You can give us a call, 954-251-2182. Always, you can visit the website at SoFlaAcupunctureWellness.com. And I'm very active on my social media. My social media handle on Instagram is Dr.Andrea Acu and Wellness, and you'll find me. I'm there. I'm doing silly things. I'm doing serious things. And it's me and my DMs. So if you have a question, reach out. I'm happy to answer. Obviously, medical information I can't give out, but I'm happy to assess you in any way. And even if you're not in South Florida, if you reach out to me and you're looking to get care, always reach out to Krystal. But I have many friends around the US that took this course with me. And so if it's not me, I can put you in touch with the right people.
Yeah, for sure. We have Andrea's clinic is, I have like five things to say. Andrea's clinic is absolutely beautiful, and it is just like an extension of her spirit. So if you are in South Florida, also we have the Pelvic Acu map. So people can
That's right.
use the map as a resource. We'll put a link to the map in the show notes, as well as all of the ways in which you can contact Andrea and connect with Andrea. Her social media is a hoot. Like, it's the best. It makes me smile every single day. I don't know how she does it. But yeah, it's amazing. It was such a pleasure. It's always a pleasure to like share energy with you. And I feel really fortunate that you're in my DMs.
Same.
Because we do have a consistent connection. But to be together face to face here on Zoom for a bit is really, really exciting. And it's such an honor.
I agree.
Yeah, I'm just so grateful for you, and I appreciate you.
I appreciate you, and I'm looking forward to seeing you in October.
In Maine. Yeah. You're joining us for round two.
I've never been to Maine. I know. I want to be there. I have FOMO.
She's like,
I don't want to miss out.
Some of my friends are going to be up in Maine. Shelvis.
Yeah.
Yeah. So
Shelvis.
Shelvis and
And I'll
Melvis.
bring her.
Melvis will be there. Elvis will be there. We'll have all the
And
pelvis
Elvis.
girls together. It's going to be a great time. So
Yes.
I can't wait to see you up in Maine. I love that you're coming back for round 2. It's hilarious that I started the Pelvic Acu like literally 1 year ago in July. And there's already been so many people that are like wanting to take the repeat classes or signed up for the repeats because they're like, I just want more. It's just a good vibe. I just like have to have more.
Yeah. Well, it's also, you know what? It's 2 days of like all of this information.
Yeah.
And you have to digest it. And then there's, well, how can I get better at it? And I need Krystal's brain with me at all times. And the only way to just like deepen those skills is by actually doing it. And like we said earlier, there's such an energy when practitioners come together, and there's different vibes of each class, and you get exposed to different types of people with different dysfunctions. And I think that's so important. And I was like, I need more, because yes, I did the whole course online, but to do it in person, there's something about touching, right? Like actually doing it. So that's why.
Yeah.
I'll do it again and again and again.
Right? I mean, why not? The more you practice, the more, the better you get and the more you learn. And, we like to think that our brains are, like of such capacity that we have all this knowledge, and we totally do. And there's so much more. There's always more. And even one nugget of wisdom that we gain, which people, if you're listening today, oh my gosh, the nuggets I feel like are huge in this one. So thanks, Andrea, for that.
You're welcome.
But just one nugget at a time is like, can be practice changing for us. And
yeah. And then there's like things that open up of like, I didn't even realize this, and conversations are different in different classes. And I think that it's just important to continue to just peel that onion and really get deeper into the practice. So
for sure,
this won't be I'll be there in October and then some other time.
Who knows
too.
When? Right on.
Yeah.
Well, stay tuned for what's possible in Florida. Yeah.
All right, Krystal. I love chatting with you.
I love chatting with you. All right.
Have a good one.
Yeah. Thank you, listeners. And we'll catch you on the next episode of the Pelvic Bowl.